In in this video, we are going to discuss important aspects of operation and implementation research. And actually, there is no standard definition for the operations or operational research. There are many definitions as stated by many authors and organizations. However, as stated in the Wikipedia, the free encyclopedia available at the website, it is a discipline that deals with the application of advanced analytical methods to help make better decisions. So it is a real discipline that will help us to apply different methods in order to develop our decisions based on evidence or on updated information. The Global Fund and the World Health Organization use it as a reference. You can see it at the end of this part. Emphasizes that operational research can generate information to enable decision makers and managers to improve their program performance. So this definition is practical and operational in that the operational research can generate information that will enable the decision makers, the manager of different programs to improve their performance through, through adopting decisions that are information based. And this is so important to consider here. The Global Fund and the World Health Organization believes that operational research has an important role to play in the success of the programs they fund, the HIV/AIDS, the TB, and the malaria program, and strongly encourages proposals with operational research to be submitted for the Global Fund. Operational research helps to identify solutions to problems related to or limit the program quality, delivery of quality of services, and as well as efficiency in dealing with the available human resources and effectiveness in achieving these stated objectives. Operational research helps to determine which alternative service delivery strategy would yield the best results. And in simple terms, described as the science of better. And operational research focuses on factors which are under the control of the programs, and it seeks to improve the number and quality of services and program outputs and outcome by optimizing, for example, program inputs like the personnel, the supplies, the equipment, or the processes like training, supervision, promotion of services, and so on. The findings and recommendation of the operational research constitute key inputs to address important areas like the needs and gaps, and to improve the quality of services and of information, and also to formulate policies and strategies as required. The aim of operational research is to make available substantive information, in the sense that information will be available for the program managers, and the data on the current situation at the level of the services, for example, at the level of the, for example, diagnostic centers for TB management, or human resources, their capacities and their competencies, and awareness and information dissemination, client satisfaction, as well as about communities and supplies, and which systems that would be appropriate for delivering supplies and communities, policy and strategy development. So substantive information will be available for current situation that will help to use appropriate information and quality information in the decision-making process. Either qualitative or quantitative methods can be used, and qualitative methods include, for example, focus group discussion or individual interviews with service providers or clients or observational studies observing healthcare providers during provision of services. Using qualitative and quantitative methods include structured questionnaire or analysis of service statistics, for example, available from the different reports and records at the health facility level. Formal epidemiological studies also can be performed. And for further information, those who are interested can refer to the World Health Organization, the Global Fund Guide to Operational Research and Programs supported by the Global Fund. Now we talk about the implementation research, which is another category, and the importance of research in identifying solutions and options for overcoming implementation obstacles and barriers in health system and programs. It's widely recognized that so many programs cannot achieve their objectives due to the poor performance or due to obstacles or barriers in the overall implementation of the program at different levels, whether at the facility level or at community level, etc. And the form of the research addresses implementation bottlenecks and identify optimal approaches for a particular setting and promotes an uptake of the research finding. Ultimately, the goal is to improve the healthcare and its delivery through overcoming different obstacles, obstructing or delaying the implementation of the program. Implementation research has been defined in various ways by different institutions and common interpretations, but in general, focus on the systematic approach to understand and addressing barriers to effective and quality implementation of different interventions, strategies, policies, and programs. The focus mainly on the barriers that delays or obstructing the implementation, whether of a certain program or health intervention or strategies or policies. So we conduct research to find out what are the best approaches that we can adopt to overcome the bottlenecks and the barriers of implementation. Implementation research is demand-driven, and the research questions are framed based on the needs addressed or identified together with the stakeholder and implementers in the health system that are individuals are directly involved in the implementation, because we are focusing mainly on the bottlenecks of implementation. So it's logic that the research questions are to be formulated based on the needs as identified jointly with the relevant stakeholders and implementers at the field level within the health system, so that we can address questions that will fulfill the needs of the implementers and the stakeholders. The need to address implementation bottlenecks is often in the setting where health systems are the weakest on or non-existing, especially in the far or remote rural areas where the health system is actually not existing at all, or it is the weakest part of the health system. Unfortunately, most of the local institutions have limited knowledge of the implementation research and lack essential capacities to frame relevant research questions and conduct and manage and interpret research results for program planning and policy implementation. Usually it's not addressed. And most of the academic and public health curricula tend not to focus on such research. Implementation research is neglected in some or other way by most of the academic institutes and not included in the curricula. As a result, most of the training does not adequately prepare researchers and practitioners to provide or to conduct and manage such research projects addressing the bottlenecks of implementation. And usually, as we have emphasized, that it is usually dealing with the bottlenecks of implementation. So it is logic that such questions will be formulated jointly with the implementers and the stakeholders. And definitely, before that, it is necessary that capacity building is needed, or it's necessary to build the capacity of the different research institutes and investigator to implement effectively such program. Thank you very much. If you would like to go for further details, the reference is World Health Organization Tropical Disease Research Fund Implementation Research Toolbook, Toolkit Workbook, World Health Organization on behalf of the Special Program for Research and Training in Tropical Diseases. Thank you very much.